Hello everyone, my name is Dr. Gokula Krishnan Kulamani, Sundaram Medical Foundation Home Care Consultant and Transitional Care. With me, I have Dr. Sungita Devagasin, Home Care Consultant. Hello ma'am.
Hi.
She's been with Sundaram Medical Foundation more than 15 years I would say, and she's been one of the pioneering home care consultants. How do you feel here ma'am at SMF?
SMF give me the opportunity to take care of the patients at home. Basically, patients who are sick and it's very difficult to move them to the hospital. That part I stepped in, and even though it's not an easy road, I could manage to navigate and do a lot of services through home care services.
True, it is very difficult, ma'am. It is very difficult to being lady with so much of travel and home care at various places. It's very, very difficult. I totally agree. I would like to give some information to the audience, ma'am. Before, just give some basics. Home care na enga, ma'am?
When it comes to home care, completely it's a patient-centered approach. Patients who are at home where it is very difficult to move them to the hospital. Bringing them to the hospital by even the conveyance is very difficult.
True, very costly.
What we do is medical professionals with a nurse, with a team, we do visit them at home. Whenever need is, we do visit them and we do take care of the patients. வீட்லயே எல்லாம் பண்ணி கொடுக்கிற மாதிரி பார்த்துக்கிறோம். இதனால so many patients are being benefited.
Very true.
Especially that elderly group, they are immensely thankful for our services.
True, ma'am. I totally agree. And with the rising population and growing people above 80, population increasing, I totally agree. The demand is and the requirement is very high and potential. What are the services that we are offering, ma'am?
Through home care, from Sundaram Medical Foundation, there is a senior consultant who is available, and you have also joined in that group recently. We do a lot of things, lot of medical things at home where it is totally lacking. So after visiting, mainly as the patient is being examined head to toe, their medications are being taken care of. More than that, patient education at home. It's not for patient alone. There's counselling for the caregiver and the nurse who is there. All these things are taken care in one visit, and it takes a long time, as basically it takes 30 minutes to 1 hour in each.
True,
visit.
Very true.
Another part is, apart from the doctor's visit, we do send the nurses for injection is needed or for vaccination purpose or even dressing. So many patients have like pressure ulcers or whatever, post-surgical thing. Dressings are well done at home. And another part of what is, there are certain services which we are not able to give from our setup. So like say oxygen and all those things through some agency who is supplying to our hospitals. So those linkages are given so that patients get all the benefits.
We make sure we meet the gap so that they are comforted with everything that we are able to provide in the safest way possible. True, ma'am. Very true. Very true. So once we visit, ma'am, how do you feel we follow up? Follow up is always a problem. As a OP practice also, coming back, everything is going to be a pain for them. How are we giving them a better end to it?
As our follow-up service is very excellent. As in the initial visit itself, we counsel the patient relatives to give a feedback, daily feedback or by even morning, evening feedback through WhatsApp. And another important thing is we do follow-up also. Okay.
Personally,
patient eppadi irukkranga. Another side is our staff nurses. They also communicate with them. Eppadi irukkreenga. Any problem is there. If they are okay, then we stop the follow-up there itself. Maybe when we review, we follow them up. So if the patients are sick, a close follow-up is, we are able to do it, and the patients are also happy with that.
It's really nice to hear, ma'am. I mean, we are personally always there in the loop and not letting out staffs or junior doctors. Where we are always in the loop, so we know from time to time what to expect and escalate care or reduce care. Super, ma'am. Fantastic.